The Gauteng Premier is worried about people gathering in huge numbers. As you heard earlier, the province remains the epicenter with 168,000 confirmed COVID-19 cases. Nqobile Madlala is following this side of the story for us. She joins us now live in studio. So we know that Bandile Masuku has been placed on special leave. How will this affect our fight against COVID-19?
Well, Shine, just like you were saying about the numbers, it's obviously an important time for Gauteng now. We are heading towards the peak. So the Premier just explaining that the MEC is a doctor by profession and that he knows what happens on the ground. So for the fact that he's not going to be there towards the peak is going to play a significant role towards the fight. And also saying that the person that will be taking over from the MEC, as obviously an acting MEC for now, is MEC of Transport. So he may not know as much as the MEC of Health because he has worked in the industry. So this obviously will have its effect, its ripple effect on the ground. But just saying that they will continue the fight, even though that he is on leave. The Premier explains.
My heart is sore that MEC Masuku, who has been doing so well, and Dibo, you are the one asking this question. I'm saying my heart is sore that MEC Masuku, who has been doing such good work in helping us to respond to COVID, faces these allegations. But we can't close our eyes to it. It does raise question marks on political leaders, on government work, and the right thing to do is what, in this particular case, that the allegations are there. We want to move on. We want to continue the battle against COVID. He stepped aside through leave of absence. We will continue the fight.
My heart is sore that we have serious allegations within government, right? I mean, sounds odd. So the numbers of reported cases have dropped in Gauteng. Tell us more about that.
Well, so from the past few weeks, we've seen the numbers drop. You remember that we had our peak. Now we're seeing about 4,000 cases per day being reported, but the numbers are continuing to drop. So, but now, Shahan, the thing is, the Premier is saying that this doesn't mean that we're no longer in the peak. We are going towards the peak, and therefore he was just begging people to say, hey, keep yourself out of risk. Make sure that you are working hard. Make sure that you have you're following the regulations. But also at the same time, Shahan, we heard from the professor who was saying that hotspots continuously change. They are dynamic in their nature, and therefore not having the numbers that we were expecting towards the peak doesn't mean that the peak is over. But let's just listen to Professor Bruce.
Here is that the fact that we seem to have some sort of up and down doesn't mean that we are past the peak of the pandemic. By no means, unfortunately, can we conclude that. What we see is basically how hotspots behave. We have learned how each hotspot behaves. If you sum them up, if you look at the dynamic of many hotspots, you will end up having ups and downs. So the upside, the good news here, is that we are in a situation where, through the combined action of improved adherence by the population to social measures and the proactive action of the Department of Health and other stakeholders, hotspots can be managed, and hotspots can grow and then diminish. And that's the good news. The bad news, unfortunately, as a result of the surge, what we have now is that transmission occurs everywhere in the province.
So the Premier also spoke about areas of concern. Where exactly are we seeing new hotspots in the province?
Well, Soweto is one of the areas that the Premier said now is an area of concern. Now, you remember, Shahan, there was a time when we thought the inner city was a problem, when Ekurhuleni was an issue. And now we heard about Diepsloot and all those areas. But Diepsloot and Ekurhuleni has now dropped. Soweto taking the peak, but more peaks seen now in Mamelodi. Makhura was just saying, Premier Makhura was just saying that this was because of a funeral. Now, you will remember that we have been told to social distance, masks, all these things, but are people really following it in the gathering? I mean, in the past few weeks, we've seen from the news, and it's really been questionable. But let's just hear from the Premier.
There was a period when Mamelodi, the Mamelodi area, Soshanguve, was worrying us. We even went there to Soshanguve with MEC Masuku, and we took the whole team to do that. And Soshanguve, Mamelodi, No, not Mamelodi, Soshanguve, Mabopane, Garankuwa area. Mamelodi is in the east, Soshanguve, Mabopane is in the west. As we speak now, the numbers are shooting up in that area. And we traced it to one funeral, followed by another funeral. On the 17th of July, there was another funeral where over 1,000 people came to the funeral. The pandemic there is certainty about it. The laws are so simple. You can be sure. If you have a gathering of people, large number of people, you can be sure that out of that gathering, the pandemic is going to reach more susceptible people. So it's very predictable. And even in family funerals, which are difficult to avoid, go into your own family funeral. You just need to have in your frame of mind that somebody in the family is going to pick up the pandemic.
All right, we're going to leave it right there. Thanks for the update. Nqobile Madlala.